Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Our topic today is very important, which is drug interactions with hormonal contraception. Really, this topic is important for all medical students, for gynecologists, for all doctors of many specialties like neuromedicine, like psychiatry, like internal medicine, and others. Also, it's important for women who are taking hormonal contraception. Okay? Simply, if a woman taking hormonal contraception and she is going to take another drug for any medical reason, this drug may affect the hormonal contraception by decreasing its efficacy, so failure rate will be high, or by increasing exposure to hormone, which may lead to side effects of this contraception hormone. So there is interaction between drugs, and we'll see in this lecture what is the interaction that may happen with hormonal contraception. Okay, so what are the objectives? To know the types of drug interactions, medication which may cause contraceptive failure, medication which may increase exposure to contraceptive hormones, medication whose clearance may be decreased by oral contraceptive pills, medication whose action may be decreased by oral contraceptive pills. Okay? Okay, let's just start with the types of drug interaction. Please look to this picture. We have two main groups, pharmacokinetic drug interactions and pharmacodynamic drug interactions. We want to know the difference. As regards pharmacodynamic drug interaction, when one drug affects another drug, through what? Through affecting absorption, distribution, metabolism, excretion. So simply it affects its bioavailability. This is the pharmacokinetic drug interaction. Okay, so we can find pharmacokinetic drug interaction in case of women taking hormonal contraception. What is the effect? We will see. Could reduce contraceptive effectiveness, so increasing the failure rate of this method of contraception. Also could increase exposure to contraceptive hormones, leads to exposure of excess hormone, leads to side effects like thrombosis in case of hormonal contraception due to estrogen, phenyl estradiol, or could affect exposure to other drugs being taken. If a woman taking hormonal contraception and another drug for medical reason, this another drug may be affected by the hormonal contraception. Okay, this is called pharmacokinetic drug interaction. Again, it means one drug affecting other drug through what? Through its absorption, affecting its absorption, its distribution, metabolism, excretion. Okay, this is the pharmacokinetic drug interaction. What about pharmacodynamic drug interaction? Simply, pharmacodynamic drug interaction means the pharmacological action of one drug may have effect on the pharmacological action of other drug by either synergetic effect or antagonizing effect. Okay, so here the interaction happen in pharmacologic effect of drug. Two drugs may have synergistic action, additive, while another two drug may have antagonism action as regard the pharmacologic interaction. Okay, so this is the difference between pharmacodynamic, the pharmacokinetic drug interaction and the pharmacodynamic drug interaction. Okay, that's what I said before. Pharmacodynamic drug interaction occur when one drug alter the absorption, distribution, metabolism, or excretion of another, so it change its bioavailability. Pharmacodynamic drug interaction occurs when pharmacologic effect of one drug influences the pharmacologic effect of another by synergy or antagonism. So give me example please for this. When a woman taking progesterone only pills and there is missed some pills and she is in need for emergency contraception and we give her ulibristal, okay, ulibristal acetate as an emergency contraception, okay. Here progesterone only contraception could reduce the effectiveness of ulibristal acetate because of what? Because of opposing action at progesterone receptor. They have opposing action at progesterone receptor. That's why when we are going to advise for emergency contraception and take history and know that the patient was taking progesterone only pills, ulibristal is not a first choice for emergency contraception in such a condition. Okay? I hope it is clear. Okay, what about pharmacokinetic interaction that could reduce contraceptive effectiveness? This is very important when gynecologists prescribe hormonal contraception. You should know about it. Drugs that induce hepatic cytochrome B450 enzymes and increase clearance of contraceptive hormones. This could result in reduced contraceptive effectiveness of all combined hormonal contraceptive methods. All progesterone-only pills, etinogestrel implant, and oral emergency contraception. So, when you prescribe a drug that induces hepatic cytochrome enzymes B450, please remember that the efficacy of contraception will be reduced of this hormonal contraception. Okay, so this is one mechanism how interaction can reduce the contraceptive effectiveness. Another mechanism to reduce contraceptive effectiveness via drugs that induce vomiting or diarrhea or alter gut transit or chelating drugs or drugs that alter the gastric pH. So this is another mechanism that how drug interaction decrease the contraceptive effectiveness. Okay? What else? The other category in pharmacokinetic interaction or other one, okay, could increase exposure to contraceptive hormone. We said before, when interaction reduces the efficacy of contraception. Okay, here we are talking about the reverse. Here could increase exposure to contraceptive hormone and so may cause side effects. So, concomitant use of drug that inhibit cytochrome enzyme B450 with hormonal contraception could result in increased exposure to contraceptive hormones and potentially increased side effects. For example, in case of ethinyl estradiol, elevated serum level could theoretically result in increased risk of thrombosis. Okay, what else? What about pharmacokinetic interaction of contraceptive hormone that could affect exposure to other drugs being taken? Here, the contraceptive hormone will affect the other drug. Okay? Use of contraceptive hormone can affect exposure to other drugs that an individual is taking with potential loss of effectiveness of those drugs if exposure is reduced, or toxicity if exposure is increased. So, contraceptive hormone may affect another drug taken for any other medical reason via what? By either decreasing its effectiveness if the exposure is reduced, or toxicity if exposure is increased. For example, one of the anticonvulsants called lamotrigine, lamotrigine used to control seizure. When given with hormonal contraception, its efficacy will be decreased and its control for seizure will be deficient. Okay, so here the hormonal contraception affecting the anticonvulsant drug by decreasing its efficacy. That's why I said this lecture is important not only for gynecologists or those interested in family planning, but also for other specialty like psychiatry, like neuromedicine, and so on. Okay, let us go to the next. We need some examples for medication which may cause contraceptive failure. Okay, because of this interaction, as I said before, this medication decreases the effectiveness of contraceptive hormone. Grazifulvine, one of them, it is antifungal medication. Carbamazepine, anticonvulsant drug, and also used as an analgesic in trigeminal neuralgia. Oxcarbazepine is an anticonvulsant also. Phenobarbital is hypnotic and anticonvulsant medication. Phenytoin and brimidone, anticonvulsants. Topiramate, anticonvulsants and prevent migraines. St. John wort, this is often used for depression and mood disorder. This is a yellow plant present in European countries used for treatment of depression and mood disorder. Rifampin, used to treat tuberculosis. Ritonavir, antiretroviral medication used to treat HIV. So, all these medication, when the patient is taking hormonal contraception, the efficacy of hormonal contraception will be decreased and the failure rate will be high. So, the gynecologist should be aware of this, and the doctors of other specialty also should be aware of this. Okay? Also, we should raise the awareness of women about that by taking her medical history and know everything. So, This is very important, as I said before. Let us go to another example. Medications, here another example, different. Medication which may increase exposure to contraceptive hormone. I mean, the drug interaction here leads to increasing exposure to contraceptive hormone, and so increasing the side effects of contraceptive hormone. Okay, what are these drugs which may lead to increase exposure to contraceptive hormone? Acetaminophen, which is a paracetamol, analgesic and antipyretic drug. Erythromycin, belong to a macrolide antibiotic. Fluconazole, one of the antifungal medication. Fluoxetine, this is a selective serotonin reuptake inhibitor used to treat depression and premenstrual tension syndrome. Fluvoxamine, also selective serotonin reuptake inhibitor and used to treat obsessive compulsive disorder and depression. Nifazodone, nifazodone is used to treat major depressive disorder, also to treat aggressive behavior, panic disorder, anxiety. And the vitamin C, which is ascorbic acid. And we know all vitamin C is important for the growth, regeneration, and the repair of human tissue. So all what I mentioned here of these drugs may increase exposure to contraceptive hormone if it is given with hormonal contraceptive. Okay, so I may expect the side effects to be more. Okay, let us go to the next examples. Medications whose clearance may be decreased by oral contraceptive pills, for example. Amitriptyline, which is a tricyclic antidepressant drug. Diazepam, which is used to treat anxiety, panic attacks, insomnia. Imipramine is a tertiary amine tricyclic antidepressant. Phenytoin, one of the anticonvulsant medications. Selegiline is a monoamine oxidase inhibitor used to treat major depressive disorder and Parkinson's disease. Okay, medications whose clearance may be decreased by oral contraceptive pills. Theophylline. Theophylline, all of us know this is a bronchodilator used to treat symptoms of asthma, bronchitis, emphysema, and many chest problems. Cyclosporin. Cyclosporin is immune suppressant used in organ and bone marrow transplants as well as in inflammatory conditions like ulcerative colitis and others. Caffeine is used to restore mental alertness during fatigue or drowsiness and in some headache and migraine medications. Okay, so these are examples for medications whose clearance may be decreased by hormonal contraception. Meaning what? Meaning more exposure to this drug, which may cause side effects from these drugs. I hope it is clear enough. Another example for medication whose clearance may be decreased by hormonal contraception. amitriptyline, diazepam, imipramine, phenytoin, Selgline. Medication whose clearance may be decreased by hormonal contraception. Again, I said it before, theophylline, cyclosporin, caffeine. Medication whose action may be decreased by oral contraceptive pills or hormonal contraception. An important example is lamotrigine. Lamotrigine. Lamotrigine is an anticonvulsant drug. How this happen? How medication whose action may be decreased by hormonal contraception. Here I mean that lamotrigine action will be reduced, less effective if you give hormonal contraception with this medication. Because estrogen and combined hormonal contraception appear to reduce glucuronidation of lamotrigine, significantly reducing the serum lamotrigine levels. Okay? So estrogen and hormonal contraception induce glucuronidation of lamotrigine and so significantly reducing serum lamotrigine. This could result in reduced seizure control when combined hormonal contraception is started and during lamotrigine taking. I hope this example is clear enough. Okay? This is the end of my lecture. I hope it is beneficial for you. This is my 3 scientific site, one for Amazon for my books here, textbook of obstetrics, textbook gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and gynecologic oncology. You can go to my site on Amazon and you can get either electronic ebook or Kindle edition or hard copy edition. Okay? The second one is the link of my YouTube channel where you can find many lectures in OB guide, family planning, also quizzes, skills, case scenario discussion, and study design and research methodology. So you can go there to find my lecture on YouTube channel. The third one, my site on Blogspot, where you can find many articles and picture of some of my operations. Thank you, everybody. Wishing you the best.